Second question, which of the following molecular mechanisms best explains the pathophysiology of this patient's condition? That's a concept because they want me to explain something. That means I have to make a diagnosis first and then explain the pathophysiology behind it. 32-year-old woman presents to the emergency department with 5 days of progressive bilateral leg weakness and numbness. So we got bilateral leg weakness and numbness suddenly 5 days later. All right, so we got to think about some kind of neuromuscular disease so far. She reports having gastroenteritis with diarrhea 2 weeks ago that resolved spontaneously. Now, when they say that, then I start to think about Guillain-Barré, which is autoimmune. Usually starts about 2 weeks after the gastroenteritis, and if they want a bacteria, or Campylobacter jejuni. Physical examination reveals absent deep tendon reflexes in the lower extremities. That's what we expect. Remember, symmetrical ascending paralysis is the clue I gave you. Weakness of ankle dorsiflexion, 3/5 bilaterally, and decreased sensation to light touch below the knees. Lumbar puncture shows white count, 8 millimeters cubed, 8 per millimeter cubed. Protein, 95, that's elevated. Glucose, 65, that's normal. Serum glucose is 90. Nerve conduction studies demonstrate prolonged distal motor latency, so that tells you prolonged neuropathy in the periphery. Reduced conduction velocities. Reduced conduction velocity, it means you have some form of demyelination. And absent F waves. Anti-GM1 antibodies are positive. So again, this goes with Guillain-Barré, which the following molecular mechanism best explains the pathophysiology of this patient's condition. So anytime you got autoimmune, remember there has to be some overlap between the infectious agent and some antigen in your body. And that's what makes you, while attacking the infectious agent, you actually attack yourself. All right, so we're looking for something that says the bacteria somehow resembles one of your antigens. E says super antigen mediated T cell activation against Schwann cells. No, remember super antigen is good with Staph aureus. D says complement independent antibody blockade of voltage gated calcium channels. No, it's not complemented to D. That doesn't say what we want. So there's a tendency to want to start trying to figure out what all that means. All I ask myself is, does it say what I wanted to say? The answer is no. Type 4 hypersensitivity reaction against myelin basic protein. I mean, it can't be type 4, so we can hold on to that. Direct bacterial invasion of dorsal ganglion with toxin production. No, it's not a direct bacterial invasion. Remember, autoimmune says that somehow some antigen the bacteria produces mimics one of your antigens. And then A says molecular mimicry between bacterial lipopolysaccharides and peripheral nerve ganglion. Now that sounds more like what we want because it says the word mimicry. Remember what I said before? If you have a thought in your head, before you look at the answers, you're more likely to find the right answer without being distracted, okay? Because we already said we're looking for something that says it mimics some antigen. All right, so we go on to the next question.